Hello, nice to have you today in this special edition. I call this one special edition because it's going to open our eyes to be able to make the right decision in certain area of life. Now listen to this. There's happen to be an ugly statistics, one should say unacceptable as it were. There happened to be a German statistical report that try to analyze the percentage of wrong diagnosis or misdiagnosis being made in different continents and in different countries, and unfortunately mentioned that 1 out of every 3 disease condition managed in sub-Saharan Africa is wrongly diagnosed. I put an exception to that, no doubt, which most of us will also say no to that. But one key thing that happened is that in a number of occasions, our presentation is usually presented in the hospital when the worst has already happened. And when you are looking at this very wrong diagnosis, as it were, it's not just only tailoring to the hospital. It's most especially when it has to do with our own assumption or what we think is responsible for our problem. And that's why we open up and say, at this very juncture, can we make this a little more of interaction? Interaction in the sense that, have a look at this very number, send that very health condition of your concern. Whatever you assume it is, it can maintain anonymous as it were, because what you pass through, other people also pass through the same. But we can come up here as we will do today to be able to find a lasting solution, the right direction to some of these things. I want you to invite your friends, invite everyone now. Come on. What you are to get today may not necessarily be for you. You have loved ones passing through what I'm going to talk today. You can save them. You can spare that money. We are all gathering for issue that has to do with burial. And I want you to do that right now, as I will be right back to give you something you will keep for a lifetime. Do that. I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, program sponsored by Dr. Save a Life Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. And today we are going further in trying to analyze some of the challenges we have vis-a-vis the way we also attend to them. And I got a very interesting message that will be of immense benefit to all of us, and also an encouragement to us to be in position to push this very agenda, put this very vision that by the year 2025, Nigerian life expectancy should leave this deplorable state of 54 years to 70 years. Don't bother so much asking me, Dr. Okoye, how do you want to do it? Hopefully from next month, I'll begin to unveil to you some of the things God has helped us to be able to package in the United States and to make it happen here in the soil of Nigeria and Africa. To God be the glory, as we are going to set all that very pace as never been before. And look at this very text message. Quite an impressive one, I will tell you. She said, Dr. Save a Life, God will surely bless you for this wonderful work. Amen. Thank you for that. I have run away from 2 hospitals after booking for fibroid operation because of fear. I was bled 26 days non-stop. After listening to your program on fibroid, I went for the fibroid operation. It was very successful. Glory to God. What can we talk about this? It is the joy of this engagement. Bleeding for 26 days is already near the grave. So many ladies are right there right now, bleeding in the name of different form of fear. If you go to hospital, you will die. If you go for surgery, you will not come back. Who is saying all this? She was in the same state and also being in position to get to the hospital. And she is hearing the testimony of being alive, having been able to get the surgery done. And she's fine today. And she added something that we need to use to make today's topic also. She said, please, my uncle has been having stomach pain for 2 months now. He hardly goes to toilet. They say it is poison, which is same they say to me about my fibroid. Please, what is the cause of this stomach pain and not able to go to toilet? This is quite interesting and something very critical for us to look into today. Apart from the fact that she has told us about the state of the uncle, she also added something very striking. She said that the uncle happened to have stomach pain, and in addition to that, couldn't go to toilet. Nevertheless, she said that they said it is poison. Just as she was told when she was having the fibroid that it was also a poison. Just come to think the kind of society we have found ourselves. But the good news is said that through knowledge shall the just one be delivered. And that is going to come to you now. If you are listening as the fellow that said this, you also know what to do regarding that your uncle. And the earlier it is done, the better for us. And today we are going to answer her, which of course answering everybody, because stomach pain in different fashion, both male and female, present. So can all of us having stomach pain also be considered in the state of the uncle? Now that brings us to the issue of, as she asks, what is the cause of stomach pain? All right. What could have been responsible for the stomach pain in addition to not being able to go to toilet? Now, let me put something across to you. There happened to be a German statistical report that stated that 1 out of every 3 disease condition managed in sub-Saharan Africa is wrongly diagnosed. Or it also could be misdiagnosis. That's what that literally means is that if 3 people present in a hospital or in any place where they say treat this very person, that 1 out of that 3 cases is most likely to be told what is not the cause of the problem, or is being treated in what is not the cause of the problem. Or there's also what is called misdiagnosis, that this particular diagnosis or a sickness was there, but was missed in the course of attempt to find out or in attempt to treat. Okay?
You and Your Health with Dr. Richard Okoye.
This very program will be very beneficial to both medical and non-medical people. All right? So, when you're talking about the issue of your stomach, the first question is, what are the organs or things in this very side of the body that should be able to elicit pain? And before unveiling this part of the body, I also want to make mention that pain is not a disease. No, get it very clear. Pain is not a disease. It's a symptom, and most times a telltale sign to something that may be very deadly. That is to say, for you to have pain, you shouldn't just be mindful of attending to the pain, because that very pain may be a signal, just like a car that wants to knock engine, all right, and it's making a knocking sound, just like that, and you just went and do everything for the sound to stop. That sound could be a trigger for you to react that something ugly is about to happen. So trying to subdue pain as a means of treatment could be a dangerous approach. To help you understand this, check out this. This is the brain, okay? And the brain has a spinal cord that goes down. You can see that? The spinal cord goes down from the brain through the vertebra down. But see the interesting thing, and this spinal cord sends out nerves. As you can see here, this from the back tend to grab over the organs around here. So they brings about what is called sensation. You can have a feeling, okay, touching something or having a pain and all that. These are the nerves that actually control that. Now, having noted this, I want you to have a look at this. So you can now see the graphic picture of such, coming out as branches of the spinal cord. All right. So if you look at this right now, you can see you have a lot of nerves. And also coming down this way. So all this, as we saw earlier, tend to come over here. Now, for you to be able to use pain as a pointer, you have to understand the anatomical locations of all those organs vis-a-vis the actual nerve that also supply them. But if you look at them right now, because there are all many, the tendency of them mixing up in terms of, getting their signals mixed up is very, very high. So now, if you look at this, now, these nerves that come out from the back will now hug in front a number of organs that you can see here. All right? These are different organs. We're going to pick them one by one. So that tells you something. That when you have a pain coming from any part of the body, number one is to have understanding of the anatomical location of the organ in question, in addition to the possible nerve also trying to supply that particular area. Because if you look at the structure here, you can see a lot of nerves. Sometimes you can see them like branches of a tree. Sometimes they form a kind of synergy, in trying to just to complement each other's work. So now, if you look at this, that brings us to the important fact. Any of these having issue can present as abdominal pain. Sometimes in women it could even be more, because there are organs in women that are not in men. Okay, so number one is that a person that is having abdominal pain, which come to this very region, he may have a kind of indigestion, dyspepsia, heartburn. Such person could have a problem that may come from the chest region, looking at the aspect that has to do with the heart. It could also come from the issue that has to do with the stomach when you have what is called peptic ulcer, as you know. It could also come from what is called hiatus hernia, when there is a problem where the inner lining of the stomach is coming out into the esophagus. So the acid there will be burning that very area. So you have that kind of pain could be there. Someone that is having heart attack could have a pain that comes even up to this much, to the abdomen, because of the interwoven nature of this particular Now we go further. Behind this stomach, you can also have what is called pancreas. If there is inflammation of that pancreas, call it pancreatitis, or a tumor, a cancer of the head of that pancreas could also be in position to bring abdominal pain. Now, going further, you can also have a problem here that is called gastritis, even appendicitis. And that comes up when somebody is having pain in this right iliac fossa. Now listen to this. Most times when people have pain, they rush for analgesic. Did you know that the pain in appendicitis is a golden gift of God to save life? If that very pain is subdued, what will happen is that very appendix problem will continue, and this person may have ruptured appendix. At that time, you start looking for the life of the individual. It is important for you to know that pain is not a disease. Don't pursue it. Let's get right the underlying cause of that very pain. Now, you go further, and what will paint a closer picture, because all what I'm talking about right now is what is called differential diagnosis. That all these things can mimic each other or could be responsible for this. It is not definitive, because only definitive is when we must have done a proper evaluation. Now, for the story that was told us that this uncle was having abdominal pain, or just pain in the stomach, as she mentioned, and also not able to go to toilet. something will be turning in the mind of a doctor and say, for this person to be having pain in the abdomen, not able to go to toilet, and obviously this person will be losing weight, because somebody who not able to go to toilet obviously not be able also to eat well, and the pain also will not allow him to eat well, so he's most likely to start losing weight. And that very individual, you should search out for intestinal cancer, where there is what is called cancer of the intestine. It could be rectal cancer, it could be cancer of the sigmoid column, or cancer along that pipe, which is stopping the flow, of the feces. If it is a case of intestinal obstruction, whereby something has suddenly blocked their very intestine, and that very person will not be able to go to toilet, such could also happen. But the actual cause of this thing has to be solved for, not the pain the person is having. Not, okay, I've not gone to toilet for some days now. Why have you not been able to go to toilet? Do you understand me? Why have you not been able to go to toilet? So it is important that a lot of things. Did you know that this very liver, the liver that is here, can also give an abdominal pain depending on how. Even the gallbladder stone, what is called cholecystitis, which is gallbladder inflammation, which is cholecystitis or gallbladder stone. When you hear doctor talk about cholelithiasis, okay? Now, we go a little further. Can't you imagine this? How many things am I mentioning just inside the stomach producing same symptom? That's why it is very, very, very dangerous for you to go on same medication based on the way you feel. That's why most of our people are dying. And knowledge will be in position to help us.
You and your health with Dr. Richard Okoye.
Now, looking at this very person, if this very person can have a very severe pain at this very two flank, coming from a problem of the kidney, it can come as a result of kidney infection, which is called pyelonephritis, or it could be in position of kidney stone. That's why it's very common. And the pain could be excruciating, very, very painful as it were. So, such a problem could all be having abdominal pain. Do not sweep it under the carpet. It is essential that the proper evaluation be done.
You and your health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye. We have a vision of moving Nigerian life expectancy forward through the power of knowledge, the fundamental thing you are receiving here. So whatever you are getting, my friend, you are now the first doctor, because people will definitely come to you and say, hey, I have this very problem. Please, as much as you lie within your way, the knowledge you get today, share. And we are looking at all what we have been blowing BB grammar. Say, can't we make this become a little bit more interactive? You could be in position to use any of these numbers. Send that health condition of concern. We can also share it here. Others will benefit. And together we can build a very healthy nation with health-wise. Now, looking at this, we got a message of a lady that told us that she was having fear of going for fibroid operation, ran away from 2 hospitals. Only when he watched one of our programs that talked about fibroid, she got the courage, went for the surgery, and she was fine. She's thanking God for that. And also mentioned that the uncle happened to have stomach pain, not able to go to toilet. They also say that it's a poison, and she was also told during her own time. And we are revealing today the cause of abdominal pain, and we are seeing a lot. To a woman also, additionally, to a woman, it is important for you to know, apart from all we have mentioned, a woman may have abdominal pain following what is called endometriosis. It could come from ovarian cyst or torsion of ovarian cyst. It comes from PID. It could come from pelvic inflammatory disease or ectopic pregnancy. When we are going to talk about something that has to do with bleeding, because I think one of the text messages I got has to do with that ectopic pregnancy, we elaborated them more. But all this could be in position to cause pain in the abdomen. What is the summary therefore? You will need to go for proper evaluation. Please tell your uncle to move to the hospital for comprehensive evaluation. And looking at the most important thing about that, the onco, the first and foremost thing is now technology says you're gonna see before you see. You can have what is called endoscopy. Endoscopy is a camera that goes through the mouth, can reveal a lot inside the stomach, a lot of what is we have discussed right now. Also, in a situation where for your onco, you may need to do what is called colonoscopy. That's endoscopy section. You have the gastro and colon. All right. The colonoscopy can be through the anus, go in and can reveal if there is issue that has to do with rectal cancer and the rest of them. But the treatment of this particular person may even involve the issue of abdominal scan, even the CT scan, MRI where applicable. So all these things should be in position to be properly done to be able to identify what is the cause of the problem.
You and Your Health with Dr. Richard Okoye.
Today's edition is actually tailored towards making us to understand the complexity that is actually involved in human nature, for which you can't just be on self-medication. You can't just be in position to say, no, I have done this, they say nothing. How are you blaming devil? Most of the people that blame him are also in the grave, which means something is wrong somewhere. Why not take advantage of the courage through the power of knowledge this young girl expressed, went for fibroid operation, and today verified. Okay, so share the knowledge you have today to everyone you know. I promise you, there is hope for the healthcare system of this country and continent Africa at large. God bless you as I see you again.
Join Doctors Save a Life Foundation. Support Vision 2025. 70 years life expectancy.